Black fungus. Black fungus, mucormycosis, is a rare infection, yet it is surging in the COVID-19 pandemic. The disease attacks people with lower or compromised immune systems. As of now, there are at least 9,000 people infected with the disease in India, from the usual number of 20 cases per year. There are multiple reasons for this. Corona infection itself and its treatment, especially steroids, compromise the patient's immune system. Since some of the patients are at risk of prolonged stay in hospital due to breathing difficulties, the oxygen and mechanical ventilator, if administered, can be an easy target for the opportunistic fungus. Lack of oxygen, high iron, and unsanitary conditions make it an ideal environment for the infection to grow. Definition: mucormycosis is a rare and aggressive opportunistic fungal infection. It is caused by the fungi of the order Mucorales. It mostly affects nasal sinuses and the oral cavity. The impact can remain within paranasal sinuses or progress to the orbit and brain. Fortunately, mucormycosis will not spread directly between humans. Causes: mucormycosis is commonly contracted when the spores are inhaled by people with compromised immune systems. The fungi and their spores are everywhere, from the soil, plants, decaying fruits and vegetables, to the dusty areas and gardens. High-risk patient. The group of people who are highly vulnerable to this disease are 1. People with weak immune systems, namely diabetes. 2. People on cancer treatment like chemotherapy. 3. Patients who use excessive steroid or immunosuppressant drugs. The group also includes the patients suffering from COVID-19 that develop breathing difficulties and being put on oxygen and mechanical ventilators. High-risk patients should be alert and notice if any symptoms appear. Symptoms: blackening or discoloration over the nose, hence the name black fungus. It can also cause watering of the nose block, facial pain, dental pain, headaches, breathing difficulties, and coughing. One of the most common symptoms is affecting the sinus, localized or extended to eyes, dental and facial areas, and brain. In severe cases, it can be debilitating, including possible paralysis, and might need amputations. Diagnosis: to diagnose and confirm this disease clinically, simple nasal endoscopy, biopsy, and MRI can be used. Radiographic findings can also help to diagnose mucormycosis of sinuses by checking the opacification of paranasal sinuses, fluid level, bone destruction, osteomyelitis. Prognosis: mucormycosis has a mortality rate of 54%, depending on the affected body part and condition of the patient. Early diagnosis and medical intervention is the best promise for better outcomes. Prevention: to prevent yourself from contracting this disease, first things first, put on your mask. This is very important, as not only the spores, but the coronavirus is also still around us. If you have diabetes, control your sugar intake. High-risk patients along with coronavirus survivors shall be closely monitored and followed up, due to the recent surge in black fungus cases in corona-recovered patients. Treatment: intravenous antifungal medicine followed by oral antifungals can treat and manage this disease. If not treated early, surgical intervention has to be done to prevent further spread, resulting in loss of affected body parts, like removal of parts of the palate or eye. CT scan and MRI can help to determine the extent of infection and guide surgical debridement.